Hi there. Welcome to The PrevenTable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The PrevenTable. Before I get started with my guest today, I want to make sure and thank Hubbard Radio for allowing us to use their space to record our conversations around alcohol and other drugs and the intersection with mental health and everyday lives. Today, I have with me Joyce Kariuki.
Woohoo.
Hi, Joyce.
Hi, Jenny. How are you?
I'm good. How are you doing today?
I am very excited to be hanging out with you today.
I'm always excited to hang out with Joyce.
Do you know that?
Joyce is a community strategist. Oh, no. You are a community strategist at PrevenTable.
Yes.
A community strategist 3? No, what is your title now? We've worked together so long. We probably have had many
Associate
titles.
Director.
There we are. Okay, say it again so everyone can hear.
So I am the Associate Director of Community Strategy.
The Associate Director of Community Strategy at Prevent+Ed.
I
With me today
Mm-hmm.
is here. So, excellent. So, Joyce and I have worked together for,
9 years?
9 years?
9
Yes.
years, yes.
So, both of us, I think, have had different titles at Prevent+Ed over the years.
Yes. I was a educational prevention person many years ago before I left, and then I am what they call a boomerang.
Yes.
I came back afterwards, and I came as a community strategist.
Yes.
Yes.
Well, Joyce is just, I will tell you all, an amazing person.
Thank you.
So many wonderful qualities about her and so many things we could probably spend time talking about. We even have joked that we don't know if we can keep our conversations to 20 minutes. We can hardly keep our conversations to 20 minutes at the office, can we, Joyce?
No, we cannot. We are crossing our fingers that this will be we'll keep on track of what we're supposed to be talking about today.
We're going to try. We're going to try our best.
We're going to do that.
Yeah. So Joyce and I also, for the listeners, I have to let you know, Joyce and I are also co-parenting a plant currently.
Yes. I love plants.
Joyce loves plants, and I have the opposite of a green thumb. I am no good with plants, and I got this really cool vase that I have in my office now, and I was going to maybe put a fake plant in it, and Joyce said,
nope.
Absolutely not. So she agreed that we are also co-parents of a plant. So we're co-workers, co-plant parents, friends,
yes.
And we've traveled for work together before, and that's been a good time. So lots of things that definitely we could fill our time talking about today. But
That's true.
I asked Joyce to join me on the podcast, specifically, Joyce. I wanted you to come because I know of all the hats that you wear at Prevent+Ed, one of the many things that you do is really help educate community members around youth development.
Sure.
And, what young people need to thrive in life. Right. And I also know you, and I also know that you take those things and that information and the knowledge, and you don't just apply it to work, that you interact with so many young people in your life too, that, it's hard to separate.
Family, let's start there. Family, community members where I do have volunteer. I do volunteer work. Mm-hmm. So I do apply all that. And I am grateful for the opportunity to work at Prevent+Ed because that has really shaped a lot of my thinking, how I approach kids, how I approach adults. When I see something going on, my mind always goes to what's going on, what happened to this particular person. Mm-hmm. Instead of asking myself, what's wrong with this person? Yeah. I ask myself, what would be stimulating this person or what would be causing this person to behave in that way? So even when I'm relating with my family, that's normally my to-go place because it helps me not to be stressed because someone talked to me in a mean way or someone said something that was not right, the way it landed to me. Yeah,
that's beautiful. And I it's just so true when we think about some of these things that we might think of as the roots or foundation of what we do in prevention, that it really transcends every part of our life, and how, like you said, how we just communicate with other people and seek to understand other people more than, looking to try to figure something out, right? We're really just looking to relate with them and connect with them and understand with them.
Oh, yeah.
So some of those theories, if we're going to go down that path that we've talked about as an organization for years that are very kind of, I would say, more common practices or common understandings of some of this youth development work is around kind of two things, developmental assets and the ACEs. So let's start with developmental assets. When I say that, what does that mean? What are developmental assets, Joyce?
So development assets are those things that we have Search Institute came up with different ways that we can be able to support young people. So we are looking at internal assets and we are looking at external assets. So that constitutes, so each and every internal and external, there are 5 aspects of it. And they go into details on how we can be able to support young people by looking at their family, by looking at their environment. We are looking at their self-esteem. How can we be able to support young people using these assets that they're talking? So these are building blocks that can be able to help young people to thrive in any environment. And the more assets a young person has, then the more they are able to thrive, the more they are able to deal with day-to-day challenges. But we see that when we do research or when we take surveys and look at whether the young people have those assets, we have seen, if you're a data person, I would take you to Search Institute, where you can be able to look at the young people who don't have very many assets. They end up having difficulties in their school. They have difficulties in how they relate with other people. They have difficulties in adjusting in different environments. But we see the ones who have more assets, then they are able to thrive despite the challenges that they experience.
Yeah, I've always really appreciated that developmental asset model because I think it has a lot of research behind it, as you mentioned, through Search Institute. But beyond the research and the, maybe more theoretical side of it, those 40 building blocks that are outlined, most of them, not all of them, but most of them are also very tangible things. And so, as adults who live in this world and care about young people, if you're like, yes, I care about young people, but I don't know what else I can do. It can seem overwhelming because we're also busy people. We have jobs. Busy. We're involved in a lot of other things in our lives. And it's like, I want to support young people, but I don't always maybe know how. The developmental assets, those building blocks, really give some simple, tangible things like, encouraging a young person to read books or spending time with a young person, not in a way that, means that we have to become totally enmeshed in their life, but, supporting them. If they love soccer, asking them about soccer, showing up to a soccer game sometimes, or,
And actually some people say well, I'm not a people's person. I don't like hanging out with people. And I always say it's okay if you are not a very outgoing person. But guess what you can be able to do with those simple, tangible things? Just saying hi is actually an asset that you can utilize. So when you're parking your car, when you get home, if you see some young people in your neighborhood, like, hi, probably next time you'll figure out what their names are and say, hi, John, hi, Julie, how are you? That's all we need to do. We don't have to be like, oh my God, I did not go to college for this. I do not understand. I don't like people like that. It is okay if you don't like people, but you can be an asset in your community. You do not have to have this rocket science knowledge.
Right.
Just being a simple hello or have a good day. Someone will stop and say, did they just tell me have a good day? Oh my goodness, I'm going to have a good day because somebody who probably doesn't talk to me a lot has said, have a good day.
Right.
Those are just the basic assets.
You're just showing them that community support.
Support.
That community love,
care.
if we really want to go there, right?
Yes.
And so I've always really liked the assets. And we've been talking about developmental assets for
ages,
right? And doing different trainings and really looking at ways we support our prevention work on that foundation around asset building. Also, one area that we talk a lot about and that has become very common in work with young people and looking at development is ACEs.
Yes.
So ACEs are adverse childhood experiences.
Yes.
So do you want to tell us a little bit about ACEs?
Oh, yeah, sure. So adverse childhood experiences are things or experiences that actually was a study that was done by CDC, Kaiser Permanente, I hope I'm saying it right. And what they did, they wanted to understand why are some young people thriving while others are not thriving, but yet they're in the same environment. And so they did this study between 1995 to 1997, and they collected data from about 17,000 people who they were able to look at 10 questions that actually factored in very distinct areas. One is abuse, neglect, and household challenges. And out of this abuse, neglect, and household challenges, they were able to come up with different questions for each and every of those categories. And those were 10 of them. So they were able to see what is going on. And that looks like probably emotional abuse. They are looking at physical abuse. They are looking at families with an incarcerated parent. Yeah. They are looking at
families with history of
mental health.
Or substance use even.
Substance use even. So based on all those, it was discovered that every one of us has at least one ACE. But the more ACEs one has, the more likelihood, when you think about also the developmental assets, the more likelihood a person will be having challenges when they become older.
It increases their risk. So the ACEs were being studied to see those challenges that young people are experiencing before the age of 18, but later in life, in their adulthood, they were still experiencing challenges based on what they went through when they were young. Yeah, and the ACEs studies, it's not even only, I should say, challenges associated with maybe, mental health or substance use, but also health challenges. It's been correlated that the increase in ACEs also lead to, higher risk of heart disease or diabetes or other, physical health challenges as well. So, that research and that information around ACEs is a screening tool.
It is a screening tool.
But then also helps identify maybe a better understanding, I would say again, of perhaps kind of what a person is happening for a person later in life. So if we can understand that, perhaps we could, address it in a different way.
Oh, yeah.
And look at different ways that we can help people be healthier too, whether that's a physical or a mental health, or really usually it's a combination of both.
Oh yeah, for sure. And I always like referencing Nadine Park's research because when I started looking at ACEs, because I was going to do a training on it, I wanted to understand the depths of who else has done these ACEs, what have they understood about ACEs. And so I stumbled across Dr. Nadine Park. And what I liked about what she said is she was drawing her experiences from her being in San Francisco and working with the kids there.
Yeah, she worked in a community health clinic.
Health clinic, and she was a pediatrician. And what she discovered, all the kids were coming to her, most of the kids that were coming to her had some sort of different challenges. They had skin issues. They have respiratory challenges. And she wasn't understanding how is this medical? Like it wasn't reaching out. So she decided to take a step back and look into other things. And that's where the ACEs come to realize that these kids, what we have just talked about those challenges early in life, like divorce, like trauma, like abuse, all those things were factoring in with how these children were presenting in the clinic.
Right.
And that makes me think how good it would be if a lot of our kids, and especially depending on what's going on, if a kid comes in, don't just look at the physical aspect of it. Look at the mental. Let's have these screenings. And that's actually what she says in her book, Deep Well, that one of the things that we need to do is make it mandatory for kids to be screened for adverse childhood experiences, because we're able to mitigate those adverse effects later in life if we can be able to deal with them at the onset or while they're in that progression of these different illnesses. Yeah.
Absolutely. So, developmental assets and ACEs, at least for the two of us who have worked in this space and know this information, kind of seem like not old news, but things that have been around a while, things that were like, yes, this is the foundation of our work. This is where we start with so many things. Yeah. I would say maybe kind of the new kid on the block here, something that we're just starting to talk about more is positive childhood experiences.
Yes.
So looking at not just the adverse, but if we really are balancing or seeking to balance risk and protective factors, like you said, I think everyone has an ACE score. No one has a 0.
No.
We all face adversity in life. We all face risk.
Yes.
But on the other side of that, there is positivity. There are positive childhood experiences. There are protective factors that are happening for young people and in communities as well. So what's the research, what's the data showing on positive childhood experiences?
Well, when you talk about data, I thought about bringing some data to it, but what we know, borrowing from for the developmental assets, it can really speak into positive childhood experiences, because I don't have the data with me right now.
Oh, that's fine.
But the data is actually really showing positive impact when we include positive. It's not all lost. Just because you have some ACEs doesn't mean that your life is doomed.
Right, of
It
course.
actually means that, hey, guess what? Because you have learned that you have ACEs, guess what? There is a light at the end of the tunnel. Because we, as the community, we're here as Prevent+Ed discussing about this and talking about this and informing our community that, hey, let's talk about not just the negative effects, let's look at the positive effects. And those positive effects look like having at least 2 people who are not your parents. Like for a kid who has developed ACEs or who has some ACEs, if they have at least 2 positive adults in their lives who can be able to support them, that young person feeling like, hey, I have someone I can rely on. So assuming like, let me use your kids, for example. Yeah. You are a positive influence to your friends, to your kids' friends. So they know that they can rely on Mrs. Amberster to help us do whatever. And I've seen that when you have brought them to some of the activities that we do for young people in our community.
Yeah.
Now, if that one kid has another person in the community who's not their parent, guess what? That child stands a better chance of having to be able to have a more successful life, a more healthier body, because they know they can be able to support, they can have the support of somebody else. Another way that we know PCEs works, positive childhood experiences, is when the child has freedom to be able to talk about their experiences at home. So if parents can be able to facilitate or have an environment whereby their kids feel free to discuss about their challenges without being shut down or without being told, like, you don't matter, that would be a positive childhood experience for that particular child. Also, having friends at high school, in their schools, is also a positive childhood experience. So that means knowing how to make friends. And that's why, again, I go back to Prevent+Ed. When we talk about those building blocks that we teach the young kids.
Programs like winning friendships,
there
right?
you go. We are setting them up for success because once they progress and now they want to make friends, they know what to do. They know how to go about it. So it's not all lost. And the data is really encouraging the community, encouraging parents. And if you feel like this is Greek that we're talking about, please call our offices, ask for Joyce, ask for Jenny. We have a lot of staff who can be able to bring this to your community. If you have a church, we also work with, church groups because we know a lot of people are also there. If it's an organization and you feel you work with young people, but you're struggling with your young people, we can support you in helping you understand the simple things that we can be able to do. And some of this can be curated, like the developmental assets. We can curate it for you if you don't have so much time, whereby we can do it for an hour or even 30 minutes just to help you understand what that really means. Yeah. So the PACEs are a positive way that now people are being told, let's not just look at the negative aspect of this. So this is like the trauma-informed approaches.
Yeah.
When we're talking about trauma, we want to talk about not just the trauma, but we also want to look at how can we be able to mitigate all those effects of what that person has gone. And if I can mention before you go on, I always also like bringing Derek Clark in this because he is the embodiment of what ACEs is. He went through a lot of trauma as a young person, as a young child, even before he was born in utero. His father beat the mom up, and the mom ended up falling down.
So a lot of abuse and a lot of trauma happening, even
neglect. And his brain was really affected in so many ways. But because of brain plasticity and because of having a positive experience from his foster parents who he has been able to become a successful adult.
Right.
Because of that. So there's beautiful stories that are out there about people who have experienced ACEs, but because of the positive experiences that they got once it was noticed that they are experiencing those ACEs, they have been able to have positive outcomes. So at the end of the day, even though we're talking about all these challenges that young people are going through, it is not all gloom.
No, not at all.
There is a beauty that will happen once we recognize them and once we allow ourselves to deal with that. And some parents have challenges accepting that their children are struggling. And some parents don't want their children to be labeled. But that's a stigma that comes with not understanding the full concept of what we're really talking about.
Right.
And that's why we are here talking about it and preaching this message that, hey, it is not all gloom.
No,
Let's come
not
out together and support our kids.
And again, there are ways we can mitigate that. And
Very
they
many.
don't have to be giant hurdles that we overcome. It can be those connections, those relationships, that understanding, and it all goes back to just being those positive influences and helping people thrive.
Yes.
Absolutely.
I love talking about this because sometimes when I am in trainings and you're talking about these things, it's like a light bulb moment for our participants because they're like, I didn't realize that I could just do that. And that will be enough.
Yeah, like sometimes people feel like they have to do so much. And it's like, no. I mean, we just have to start somewhere. And
information is power.
Absolutely.
Information. If we don't have information, then you have misinformation because sometimes you think or people think that, oh, I don't want to be labeled or I don't want to look like a failure. Nobody's a failure. There is no manual of bringing up kids.
No, I wish there was sometimes.
Even if there was a manual, sometimes you're reading a manual and you do the wrong thing still.
Yeah.
We're human beings.
Absolutely.
So just accept the reality that no one is perfect And even us who are in this, sometimes with our children, we may go astray. And that's why we have the support of Prevent+Ed as a lovely community, and we support each other, and no one is doing the wrong thing. Everyone is doing what they're doing the best. They're doing their best.
Doing the best.
So
we can,
parents out there, you're doing your best. Reach out to us. It's a no judgment zone at Prevent+Ed, and we are more than happy to talk with you and chat with you or bring resources to your community.
Excellent. Well, thank you, Joyce.
Anytime.
As Joyce said, for all our listeners, if you'd like to learn more about developmental assets or ACEs or positive childhood experiences, feel free to connect with us at PreventEd.org. I couldn't have asked for a better guest than Joyce to wrap up Season 5 of The PrevenTable. I want to thank all the listeners. It's been my first season as host, and it has been so much fun, and I'm really looking forward to Season 6. So we will be back in 2026 with our 6th season of The PrevenTable. But for now, we'll take a break over the next couple months, and we'll look forward to talking with you all soon. Take care.
Jenny.
Thank you, Joyce.
Thanks for joining us at The PrevenTable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at PreventEd.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The PrevenTable.